First of all, fill the bottle with sterile water. Ensure that this is filled to the prime level. You then want to remove the hard portion of the plastic tubing from its wrapper and insert it into the bottle as demonstrated here, twisting to lock. Try to keep the rest of it as sterile as possible in the packaging. After washing your hands, you should then place the gown on as you will have done for several other procedures. Following this, put on your sterile gloves. Clean the area you intend to insert the drain. You should follow local guidance, but this demonstration gives you a good idea. You should always start from the centre and work out. Once the area has been cleaned, you can then apply the drape, which should be within the anaesthetic pack. Again, this will vary from local guidance. You should then draw up your local anaesthetic into a 10 ml syringe. Replace this needle with an orange subcutaneous needle. You then want to administer a small amount of this just under the skin to provide anaesthesia. Once this is done, you could leave this ideally 30 to 45 seconds, replace your subcutaneous needle with a green needle, go through the same spot that you just applied the local anaesthetic, and anaesthetise down to the pleura, aspirating before administering. Once you achieve a good aspirate of air, you should then withdraw the needle slightly and attempt to anaesthetise the pleura. This is the most sensitive area, so this is very important. You should then lay out your equipment as so. You have the 10 ml syringe with the drain insertion needle. The wire. Ensure that the blue cap straightens the end of the wire and the wire is within that. Your scalpel. Dilator. Your drain. And finally the tap. Take the drain needle and the 10 ml syringe, and through the same point in which you inserted the local anaesthetic, aspirating as you go, push the needle through the skin, subcutaneous tissues, pleura, and into the pleural space. Once you achieve a good aspirate, remove the 10 ml syringe, placing your thumb over the end of the needle. Pick up your wire, insert the wire through the end of the needle. You can see that the hand is constantly holding the needle at present. Feed the wire through the needle, ensuring that there is no resistance. If you feel any resistance, then this is a reason to stop the procedure, as it is likely that you are in the wrong space. Once the wire is fully fed in, you can then remove the needle and slide the needle over the wire. The wire should always be in the non-dominant hand. Use the scalpel with the blunt side against the wire to create a slightly larger hole. This will just allow easier passage of the dilator. Take the dilator, feed it over the end of the wire, and in one smooth motion, push and twist the dilator through the tissues and into the pleural space. It should be fairly obvious once you break through the pleura. Remove the dilator. At this stage, you can take the drain. Slide the drain over the wire and push the drain through the tract and into the pleural space. You will see markings on the drain. Ideally, this should be pushed up to 10 to 14 centimetres. However, this will vary on patient size and the size of the pneumothorax you are attempting to drain. You can see the markings here. Once the drain is in place and at the appropriate length, you can then remove the wire from the end of the drain. Once the wire is removed, you can remove the stiffener from the end of the drain. Place your thumb over the end of the drain once the stiffener has been removed, and then attach the tap. Ensure that the tap is in the off position and the white cap is on the extension, as demonstrated. Attach the drain connector to the other end of the tap, and then the other end of the plastic tubing that you prepared earlier into the connector. This then connects the drain to the bottle, and at this stage you should see swinging and bubbling. You can now turn the tap on. In order to suture the drain in place, initially with a straight needle go in under the skin, 1 to 2 centimetres later, come back out the other side. Once you are out through the other side, pull the suture so you have an equal length in each hand, and then with the scalpel remove the needle. You want to create an initial loop, so do a standard knot, and then double knot this. You can use the dilator up against the skin in order to pull this as tight as possible, as demonstrated here. You then loop the suture under and over the drain, and then perform a standard knot. Ensure you try to pull this as tight as possible. Be careful not to pull it too tight, as the suture may then split and you'll need to start over. Double knot this on each occasion. Loop the suture back under and over once again, and then do the standard knot once again. Double knot this. You can then repeat this up to 3 to 4 times ideally, but more if you feel comfortable. The more sutures, the more secure the drain will be. You can then apply a dressing which will vary again according to local guidance. This may be a specific drain fix dressing or just a membrane dressing. Once the suturing has completed, you can cut off the remaining suture. You can then remove the drape and then send the patient for a chest x-ray once you are happy it is all in the correct position.